coaching program, Level Up Psych Q&A, and this program is basically going through. Basically, it's an opportunity for you to be able to ask me questions directly. So I'm going through all the topics that our members have asked, and I'm making videos on all of that. So yeah, I think let's just get into it. So that way you get direct answers to your questions, the things that you were wondering about, the meds that you're on, the therapies that you're going through, and the personal issues that you're having. Okay, so here's what we have to know about venlafaxine or Effexor. So this is a very common antidepressant that a lot of people use in mental health. So, you're probably, if you're on it, a lot of other people are on it too. So it's been studied a lot. And so it's definitely something that, there's a lot of info and studies on. So that's good. And it's often chosen when SSRIs don't work well enough or if there's both significant anxiety and depression. Like I think about Effexor as like I've already done this one. I forgot I've already made this video. So let me switch to Vyvanse. Okay, here's what we got to know about Vyvanse. So Vyvanse or lisdexamfetamine. Okay. Okay, here's what we got to know about Vyvanse or lisdexamfetamine. So Vyvanse, so it's a stimulant medication and it's used mainly to treat ADHD, but also a binge eating disorder. So it's something that helps us really improve focus, attention, and impulse control. So the main reason we use this for focus, any kind of impulse issues. Hold on. I think I just need to redo this again. Okay, here's what we got to know about Vyvanse or lisdexamfetamine. So this is a stimulant medication that's very most commonly used to treat ADHD, but also used to treat some binge eating disorder as well too. So it's a little bit different than all the other stimulants, so that's why it's important to talk about. And like, here's the things that you should know if you're taking this med. So one of the main differences that Vyvanse has, so it's what we call in the mental health world, it's called a prodrug. So that means it's inactive when you take it, and slowly your body converts it into its active form, called dextroamphetamine, which is like the basically like immediate Adderall, but it's slower released. So this slow conversion, so it helps it make it long acting, so about 10 to 14 hours, and it also lowers the risk of abuse or addiction because your body you can't get the like a high off it immediately. It takes time to build up, and it only does it if you swallow the medication. So any kind of like snorting or other injection will not convert it to its active form. So that's what gives it that smoother release as well too. So it's like a slow, long extending Adderall. That's the best way to think about it. So it comes in a variety of forms, 10 to 70 milligrams, and then same with the chewable ones too. So this makes it very easy to dose you depending on how much benefit you, where you're at. So basically, it's approved for ADHD. That's the main thing. And generally, the starting dose is about 30 milligrams per day. Of course, this can vary depending on the person. Like some people who are very sensitive, I might start them at 10 or 20. But then others who are very, they have high metabolisms or they have a high tolerance, you could start them at like 50, for example, without any issues. So the max dose is generally 70 milligrams per day. However, I have gone higher in the past for people who are faster metabolizers and who just have a greater tolerance. This is just like what the FDA approval was done for the study, but in real life that people they don't tend to meet like exact nice criteria that the studies outlined. And then similarly in binge eating, it's got the similar dosage and usage as well too. Basically, with binge eating, the way it works is it helps reduce appetite, and it also helps reduce impulse control. So that's the main two things. So as I mentioned, used for ADHD, binge eating disorder, and then side uses are also for weight loss, for fatigue, to boost up mood disorders, right? Those are side areas to use it in, but the main ones are these two. So, the benefits of Vyvanse, so people who take this, they say it helps them to focus for longer periods. They can start and finish tasks more easily. They feel less distracted or impulsive, and it helps them improve their organization and their planning. And their effects usually begin 1 to 2 hours after taking it, and they last throughout the day. So that's the nice part, is the lasting throughout the day. That's the key thing. And so, like all the stimulants, Vyvanse can cause some side effects, especially when you're starting or changing the dose. So that can be decreased appetite, sleep issues, dry mouth, irritability or mood swings, heart rate or blood pressure, or anxiety or jitteriness, especially early on. And so most of these effects, thankfully, are mild and temporary. But if they're intense or they persist, then you might have to adjust the dose, usually by lowering it and keeping it at a lower dose for a while until you get used to that side effect. So, how to take it? Usually, you want to take it once in the morning. Because if you take it too late, it can affect your sleep, right? Because remember, it lasts 10 to 12 hours. It comes in capsules or chewable tablets. The capsules can be open and mixed, so that's nice because it's got that slow absorption. And the chewable tablets, mainly for kids. And you can take it with or without food. But the main thing is to be consistent, right? So food can slow down the absorption a little bit, but then it can make it last a little bit longer as well, too. So basically, you just have to be consistent in how you use it, so that way we can actually track your effect best over time. And you want to try to take it around the same time each day, so that way we can really monitor how it's doing for you. You can notice when it kicks in, when it stops. So that way, when we check back in, you're able to give me good data, or you're able to give your prescriber good data, and they can adjust from there. So things you want to watch out for are sleep issues, right? Since Vyvanse lasts a long time, it definitely has the propensity to cause sleep issues. You want to avoid stacking it with caffeine too, and especially later on in the day. Loss of appetite as well too. So sometimes people will eat a big breakfast, or they'll eat a big dinner after it wears off. Emotional crashes. A lot of people feel like irritable or down as it wears off. So sometimes what I do in that case, right? So I find that maybe I need to use an immediate release to get them through that little hump until bedtime reaches, or maybe we just need to decrease the dose a bit. And over focusing and overthinking too. So I literally had a patient tell me yesterday that she took Vyvanse, she got started straight on 60 milligrams, and she became way too focused and anxious. So in her case, I think the dose was just way too high. And that can happen, right? Like if you just start at a super high dose. So that's why the key, if I'm trying to prescribe or like decide what dose is right for you, I don't want to start you too low, because then you feel like it's not working and you get discouraged. But I don't want to start you too high either, because then I feel like you might have a bad experience from the jump, like that one patient told me. So that's why trying to find that right starting dose is key. So there is some addictive potential, right? It is a controlled substance. But if it's taken as prescribed, it's not considered addictive the way street substances are, right? So it's got low abuse potential because of this reason, because one, due to its slow onset, so that contributes to low abuse potential. And the second thing is that the doses are not typically high enough compared to street doses. But you still should be cautious, right? And you want to discuss it with your doc, especially if there's a risk. So it can build some tolerance, right? So traditionally, it's not the same as like something else. It's not the same as, like, for example, sleep medication. But this is important to be aware of, that like life stress, sleep changes, or mood issues can affect how well it works. So, for example, like one of my lawyer clients, so he says that, like, okay, when he sleeps well and he's eating good, he feels like his Adderall works fine. But when he is not doing those things, like if he doesn't sleep well, then he feels like his Adderall barely works. And that's because that makes sense, right? Like it's like the medication's trying to compensate for some of that focus. So if you don't sleep well, then it has more to compensate for. So if it feels like it's wearing off too fast or it's not working, that's when you want to talk to your provider to adjust it. So main things to recognize for Vyvanse, so it's long acting, mainly used for ADHD. It's absorbed slowly. That's for more smoother all day effects, right? It doesn't kick in immediately, so it takes a little bit of time to kick in. Side effects usually pretty manageable and improve over time, and you can always decrease the dose. You always want to follow your prescriber's instructions, right? Reach out to them if you notice changes. Just remember that you guys are working together as a team to figure this out. And if it's used correctly, it's a game changer for a lot of people. A lot of people on ADHD really do well on Vyvanse, and it definitely has. It now is generic too, which is nice. So it definitely has its own. It has its unique benefits, but you just got to be cognizant of some of the side effects. Also, one more thing to note that sometimes generic can feel different than brand for some people. Doesn't happen to everyone, but I've definitely had patients tell me that. So it's just worth noting that. Okay, perfect. So that's Vyvanse, and now we're going to cover Saphris. Okay, here's what we got to know about Saphris or asenapine. So this is an antipsychotic medication that's used to treat mental health conditions like bipolar and schizophrenia. So these are the main two things. It really helps to regulate mood, reduce psychosis, and to stabilize your thinking. So its FDA approvals are mainly for schizophrenia and bipolar, like manic or mixed episodes. Sometimes your prescriber may use it as an add-on to mood stabilizers like lithium or valproate. But it's used off-label for other stuff too, for agitation or for mood stabilization. So it's got some benefits in depression as well too. So, but the main things are for schizophrenia and bipolar. So it affects dopamine and serotonin receptors in the brain. So that's where some of the mood benefits come in, is from that serotonin help. So this helps to balance out mood, perception, and your behavior, right? Hallucinations, that type of thing. So by doing that, it can help decrease manic symptoms, reduce hallucinations and delusions. It can help improve mood stability, and it can decrease irritability and agitation. So some of the unique things about Saphris, right, is because it has that serotonergic activity, the serotonin activity here. So that's what gives it some of the mood benefits. Whereas if it was just pure dopamine blocking, then it would mainly be used in schizophrenia. So it comes in a few different forms. So 2.5 milligram, 5 milligram, and 10 milligram. So it's important to recognize that it's a sublingual, meaning that it has to be placed under the tongue and allowed to dissolve. So you can't swallow it. So that's the difference here. So it's given better to the patient who's not going to swallow, but you have to be consistent with not swallowing it, because if you swallow it, then you're not letting it fully absorb. So a starting dose that I might give would be 5 milligrams twice a day, and then bump it up to 5 to 10 milligrams twice a day. And similarly, so that's for schizophrenia. If I'm trying to treat bipolar, especially if you're manic, it might just start you at 10 milligrams a day, pretty strong. And this is usually just in mania. If I'm trying to treat more like a maintenance or mixed episode, or maybe a depression episode, then I might start a little bit less. But main use is for mania, and that's usually where we want to kind of shock you out of it quickly. But if I'm giving it as an adjunct to you're already on another med, then I might start you off a little bit lower. And then also used for kids bipolar as well too. So there we would just start it off a little bit lower. So yeah, as I was mentioning, so it's not swallowed, but it's a sublingual tablet. You got to let it dissolve, right? So you don't swallow it. You don't want to eat or drink anything for 10 minutes after taking it, right? Because that might force swallowing. It can leave a numbing or bitter taste in your mouth. So that's pretty normal, but just be aware of. And you definitely want to take it exactly as it's prescribed. So Not everyone experiences side effects, but some people may notice drowsiness or sleepiness, dizziness, lightheadedness, numbness, tingling, weight gain, appetite increase, restlessness or jitteriness, and muscle stiffness or slowed movements. This is more in rare cases, and it's a known side effect of most antipsychotics, but definitely, like, these ones are more common. And they're mostly mild and they go away over time. But you do want to be aware of them and talk to your provider about them too if it persists. Uh, but then there's more serious ones that can happen too. So, like uncontrollable movements of your face, lips, or tongue. That's something that we call tardive dyskinesia. Again, it's very rare, but it can happen. Saphris is not too high of a risk of it happening with. Some of the others are higher, but still be aware of. Muscle rigidity, fever, and confusion. So those are a sign of something called NMS. Like, this is a condition that needs to go to the hospital to treat, but again, very, very rare and usually in very high doses of antipsychotics. Increased thoughts of self-harm, so that can happen as well. And any kind of allergic reaction. So some people may just be allergic to it. So, the main things to be successful in this, so you want to be consistent, you want to take it at the same time every day. You want to be avoiding alcohol or sedating stuff because that can increase the drowsiness, cause some sedation, respiratory depression, basically decreased breathing drive, that kind of thing. You want to tell your doc about any other meds or supplements you're taking. Definitely let your provider know if you are pregnant because then it's not like it's not indicated for pregnancy, but there's better choices out there. And you don't want to stop it suddenly too. So you can definitely have, the underlying symptoms coming back or some withdrawal effects too. So overall, main things to know, it's sublingual, so it has to be dissolved under the tongue, right? Used for schizophrenia and bipolar. It helps with dopamine and also serotonin. So the serotonin is what gives it some mood benefits too. The dopamine blocking is what gives it the antipsychotic delusion hallucination benefit. Side effects include drowsiness and mouth numbness. Those are the most common. And you want to stay consistent with it and then work with your provider to monitor those effects. What do you recommend for PTSD? Generally, SSRI. But also there's a couple other meds that I like too for PTSD. So a good place to actually ask detailed questions and like to talk about your situation a little bit more in detail is in my so I have a coaching program. Basically, it's on Q. It's like a Q&A where you can actually ask me questions and and learn about all the different conditions that exist that you might have. So, like, I'm going to record a PTSD module soon too, on how exactly I go about treating it. So definitely check that out if that interests you. And you can also send me a message too, and I can see how I can best help you. So let me do that. Yes, you can also send me a message as well. Okay, so now we're going to talk about Prozac or fluoxetine. So this is a antidepressant. It's an SSRI class, and so it's very common. It's been around for a long time, and it's got a lot of studies and a good safety profile behind it. So it's definitely one that we know a lot about, which is good. So FDA approval. So basically, this is what the FDA sought out recommendation or like the drug studies. That's what they sought out approval for. The drug company did. So it's major depressive disorder, OCD, panic disorder, bulimia, and also premenstrual dysphoric disorder. So these are the things that it sought out approval for. But it doesn't mean that it can't be used for other stuff because other studies not conducted by the drug company looked at this. So that's issues off-label for anxiety, for PTSD, and for bipolar depression. So how does it work? Basically, it works by balancing serotonin levels. So this serotonin helps with mood, helps with anxiety, helps with sleep. And so by increasing serotonin, it can help improve emotional stability, it can help reduce anxiety, and it can help support healthier thought patterns. So all of these above. Basically, it helps increase the levels of serotonin. So dosage forms, it comes in 10, 20, 40 milligrams. Tablets are 10, 20, and 60, right? Mainly the capsules are used. They're cheaper, and insurance tends to cover them. I've run into difficulties with coverage of tablets. There's an oral as well, too. And the oral is nice if you have trouble swallowing. And there's a delayed release as well, but I've almost never seen this used. So mainly, like, your doc will probably prescribe you the capsules, and just because they're the cheapest, most covered by insurance. So use for major depressive disorder, generally I'd start at about 10 to 20 milligrams, can go to about 80 milligrams maximum. Panic disorder, start at about 10 milligrams, go to 20 to 40, and usually go to about 60. OCD tends to need a higher dose than normal, so that's why 80 milligrams is not uncommon, especially for Prozac and for OCD treatment. And you can also use it for bulimia, and generally you'd go to 20 or 60 milligrams, and you get there pretty quickly. So don't be surprised if you get to this dose right away if this is what's being treated. And then it's also used for PMDD. So basically you can use it either 20 milligrams or during the luteal phase, so the 2 weeks before the period. And so this is a good choice for that because it lasts a while. So I have some patients who take it only the few weeks before their period. So that makes a big difference for them. So usually takes about 2 to 4 weeks to start noticing an improvement, but the full effects can take up to 6 to 8 weeks. Usually you notice like some of the physical symptoms getting better first, and then mood and motivation, they improve a little bit more gradually. So main thing to remember is that the consistency is the key. So even if you don't feel better right away, you want to stick with it and like share that with your doc. So common side effects are they're mild, but they go away in a couple weeks. And so common ones include nausea, upset stomach, headache, insomnia, vivid dreams, sweating, feeling more anxious at first, sexual side effects. So that's a big one, right? Lower libido or difficulty reaching orgasm too. So all these are pretty common in SSRI side effects. So definitely let your doc know if they are happening. This one, the sexual one, can persist a little bit longer, so it is worth noting that. So one of the things that makes Prozac unique is that it's got the longest half-life of all the SSRIs. So this means that it stays in your body longer than normal. This also makes it less likely to cause any withdrawal symptoms too. So if a dose is missed, so it's really good for people who are either A, sensitive to side effects, or B, if they have medication consistency too. So it makes it really easy to come off of. And it can be taken either in the morning and the night, but it's activating for some people, so that's why I recommend trying the morning first. This, like, anecdotally also gives it some ADHD benefit as well, just because it's more activating for some people. And so that if someone has a low energy depression, then that can make this a good choice. And it's least likely to cause weight gain as well too, so that's also a benefit. Things to be aware of though is that it can increase anxiety or agitation early on. So it usually gets better with time, but it's definitely noteworthy. It can increase harmful thoughts in young people. So you do want to be able to report any changes to your doc. You don't want to stop it suddenly. You always want to taper it as well, right? Luckily, if you do stop this one, like, it's got the least withdrawal, but you still want to be working in conjunction with your provider, right? You guys are a team working together, and you want to avoid alcohol or other sedating substances. Thankfully, like, this is not the worst one to do it with. SSRIs tend to be decently tolerated with alcohol. This one is because, like, they're not really that sedating, or they don't really decrease respiratory breathing drive, or they don't decrease your blood pressure as well. But the thing with Prozac is that it can interact with alcohol, just because this one lasts a long time. The Prozac does, so that way, let's say you take it in the morning and you drink at night, like, it's still definitely in your system at still a high level, so just be aware of that. But definitely call your provider if you have severe mood swings, severe irritability, or super anxiety. If you have any kind of unusual thoughts or behavior, right, like something that doesn't seem right, it can flip people into a manic episode sometimes, like if they're bipolar prone. So be wary of that. Any kind of trouble sleeping that doesn't get better, any type of concerning or persistent side effects, and any signs of serotonin syndrome. So confusion, heart rate, sweating, muscle stiffness, all of these, you want to call your provider for sure. So overall, It's a very good SSRI. It's very well studied. It helps treat depression, anxiety, OCD, and some other stuff. And it works by boosting serotonin in the brain. It's got benefits that build gradually. It's not something that you notice immediately, but it's over time. Side effects are generally mild and short-lived. However, some people can have them persist for longer. For example, there's more thought coming out that there's some sexual dysfunction that can persist after coming off antidepressant. It doesn't happen to everyone, of course, but it is worth noting. It's got a long half-life, so this gives it a risk for withdrawal. It can be activating for some people, so that's why it can help with low energy and ADHD. And you always want to talk to your doc before you stop this, or you change your dose. Due to fluoxetine's half-life, you don't need to taper off it technically, but a lot of patients prefer tapering off of this just for psychological reasons. They feel safer coming off of it if we taper, but you don't technically need to. Can serotonin syndrome still occur if you're taking the correct dose? Very rarely. It's more when you stack a bunch of doses or you just stack multiple meds together. It very rarely occurs with just one SSRI. Okay, so here's what you got to know about Klonopin or clonazepam. So this is a med in the benzo family. So it's used to treat anxiety, panic attacks, and some seizures. And it works by calming the brain and the nervous system. So because it acts quickly and powerfully, it can give a lot of relief. But it's a medication that's got to be used carefully too. So its FDA approvals are for panic disorder, for seizure disorder. These are the top two things, but it's also prescribed off-label for generalized anxiety, sleep issues, manic episodes, tics or movement disorders, and acute anxiety spikes too if you're starting an antidepressant. So definitely be aware of that. It's used for a lot of things. So basically the way it works is it helps enhance the effects of GABA. And GABA is a calming neurotransmitter in the brain. And so normally this competes with glutamate, which is an excitatory neurotransmitter. So this actually helps slow down overactive brain activity, and that's how it can help reduce anxiety, panic, or agitation. So it usually starts working within 30 to 60 minutes and can last about 6 to 12 hours. So that's nice. It can last a while. And that's why I like using it, is because it lasts a while. And it's the addiction risk. I mean, it still has an addiction risk. I'll get to that, but it can be a little bit less because it doesn't kick in immediately. So it comes in tablets of 0.5 milligram, 1 milligram, or 2 milligrams. Those are the normal tablets. And then there's an orally dissolving one, which tends to kick in a little bit quicker at 0.125, 0.25, 0.51, and 2 milligram. So there's definitely a lot of variety to really get the optimal dose for you. So for panic disorder, typically you start at 0.25 milligrams twice daily. Typical dose is 1 milligram, and the max dose is about 4 milligrams. For a seizure disorder, you would start at 0.5 milligrams 3 times a day. Go to 1.5 to 3, and then go to about 20 milligrams. So seizures, you might be on a much higher dose. This is used very rarely for seizures. It'd be more like to stop a seizure. That's what usually Ativan's used for, or if let's say there's some breakthroughs that happen despite being on an anti-epileptic, that's when this would be considered. And anxiety off-label too. So this is just like general anxiety, right? So 0.25 to 0.5 once or twice daily. Typical dose might be 0.5 to 2 milligrams, and generally less than 4 milligrams per day. So once a day is usually enough for many people, but some people do need twice a day coverage too for it. So it just depends. But overall, it's a very, very common medication that it's used for. So the nice thing about it is that the reduction in anxiety is rapid. It doesn't happen it happens quickly, unlike an SSRI, which takes time to build. It can help with sleep, muscle relaxation, some reduction of physical symptoms like racing heart or shakiness, and fewer intrusive or overwhelming thoughts. So it can feel like immediate relief, which is good, but then that's why it's got to be used cautiously, right? Because that's where dependence can come in. So common side effects include drowsiness or sedation, dizziness, lightheadedness, slower thinking or memory issues, fatigue, lack of motivation, concentration issues, or coordination problems or unsteady walking, right? Some of the dizziness. So it's definitely worth being aware of. And then there's also a thing called, this one's rare, but paradoxical agitation. So kind of like alcohol in a way where like, it's supposed to be calming and sedating, but some people can get more like riled up from it. So similarly with this as well. But usually it's dose dependent. So that's the key thing to be aware of there. So safety wise though, important things to be aware of is tolerance. So tolerance can develop quickly, and then over time, the same dose can feel less effective. Dependence, where your body becomes used to it, especially if it's used daily, right? So, and like basically starts craving it, and then that can lead to an addiction risk, right? So if there's a pre-existing history or if it's misused, then that can lead to a risk there as well. Stopping suddenly can cause serious symptoms like anxiety, insomnia, tremors, or even seizures, right? So definitely be aware of that. And so you always want to taper it under a doctor's guidance. So this is where we can run into trouble where, like, let's say you're taking it regularly for a while, then coming off this med can be hard. Also, combining with alcohol or other opioids is dangerous with this one. So unlike, like, let's say an SSRI where it's more, you can get away with more drinking once in a while, like this you do not want to do it because it can cause significant sedation, it can cause respiratory depression. They both hit the same receptor, so they can definitely cause an overload in that response. And then if you're taking, it can cause some withdrawal symptoms as well too, especially if you stop taking the alcohol. So to use this safely, you want to use the lowest effective dose for the shortest time. You don't want to be decreasing the dose on your own. You definitely want to avoid alcohol, sedatives, or driving on this, especially if you get any kind of drowsiness, right? You definitely let your doc know if you want to stop or reduce. You don't want to stop this one suddenly. And if we're using it for anxiety, this is better for a short term. So that's where we want to look at more long-term treatments too, to reduce the dependence and withdrawal risks on this. So this is really helpful in the short term, but it's not really designed for a long-term daily use. That's where other treatments really come in helpful. But your doc may also use it as a bridge, or like for like a longer-term plan, like therapy or medications, or for as-needed situations. So I've done this for both. Like I have some patients who actually do take this regularly, just because like some of the other stuff they're also doing, and it's not fully working. So that's it's an acceptable use of it. So that's why you always want to work like risks and benefits with your provider, right? But as needed, that's the most common use for it. So it's fast-acting, anti-anxiety and anti-seizure. Works by calming brain activity through GABA. It's very effective, but then there's also the risks that you got to be aware of this one. But it lasts longer than the other benzos, so that gives it a slightly less addiction risk, and it activates a little bit slower, so it's slightly easier to come off too. So that's why if I'm trying to help a patient come off of a benzo like Xanax, I'll usually switch them to either Klonopin or Valium and then taper slowly there. And it's best used as a short term or as needed, not as just like a standalone long term. And yes, you never want to stop this suddenly. But overall, this is my favorite benzo. Like I use it very frequently, for the right patient. So just be aware of that. There's no shame. Like if you're taking it, right, if it helps you, it helps you. And yeah, that's what you got to know about Klonopin. Yeah, sometimes it can feel like it's not fully working. It depends on like your baseline level of anxiety too. Like some days, if you're better off than others, then it has more to compensate for. So it may feel like it's not working as much. Okay, so here's what we got to know about Vraylar. So this is an atypical antipsychotic, and it's used to treat mental health conditions like bipolar, schizophrenia, and depression. Usually as an add-on. So it helps to regulate mood, stabilize thinking, and to reduce symptoms like mania, psychosis, or some emotional lows too. And so Vraylar, so it's the antipsychotic. It's often chosen because it's got a long half-life. So you only need to take it once a day, and it has less risk of sedation and weight gain than some of the other antipsychotics. So that's pretty nice. Uh, and then the unique thing about it, so it's used for schizophrenia and bipolar, right? So just like the other antipsychotics for most of them, but it also has the benefit of depressive episodes and as an add-on to antidepressants. So that's helpful too because it has some serotonin activity. So it's got dopamine blocking activity, which a lot of the others antipsychotics do as well too, but it's got the serotonin activity, which really helps. This is more of a technical thing, but it does this thing called partial agonism, where basically instead of just blocking the receptors, it also helps with, it kind of like modulates them, balances them out. So by balancing them out, overactive and underactive one, it kind of stabilizes things better. So that's the nice benefit of it. Um, and it's got a long half-life, so that's really helpful because then if you miss a dose, it's not a big deal, and you only need to take it once a day, and it really helps to maintain stability. But it also means that if you make any dose changes, it takes time to take an effect. With those dose changes, it's not as quick, and if you have any kind of side effect or something, then coming off of it, they can last longer. So the capsules are 1.5, 3 milligrams, 4 milligrams, 4.5, and 6 milligrams. So be aware of that. The starting condition or the dosing condition, so schizophrenia, generally about 1.5 milligram once a day. Typically, you go about 1.5 to 6 milligrams, the max dose being 6. For bipolar disorder, manic or mixed episodes, the starting dose is generally about 1.5. Typical dose would be about 3 to 6 milligrams, and the maximum dose is about 6 milligrams a day. So that's the nice unique benefit here. For bipolar depression, the starting dose is often 1.5 milligrams. Typical 1.5 to 3, and the maximum dose is about 3 milligrams. So you see the difference here that for the depressive phase, we only go to about 3 milligrams for depression. But for the bipolar manic phase, that's when you go to about 6 milligrams. So that's a little bit key difference there. So common benefits, so this reduces mania and psychosis. It helps stabilize mood. It can help relieve bipolar depression. And it can reduce depressive symptoms when it's added on to a antidepressant as well. So that's nice. And it can also cause less sedation and less weight gain than other antipsychotics. So those are all good benefits of it. But side effects that can happen, so restlessness or feeling wired, like akathisia. So this is similar with the Abilify or Rexulti. Insomnia, nausea, tremor, dizziness, fatigue, or drowsiness in some people, but it tends to be less, and it can cause increased appetite or mild weight gain. It's definitely less than the other antipsychotics, but definitely still be aware of this. Just like more safety warnings, right? Some of the long-term stuff. So it can cause a risk of extrapyramidal symptoms like stiffness, tremor, restlessness. These two, the muscular ones, are definitely more rare with Vraylar than some other ones like Haldol or Risperdal, but you definitely want to just be aware of this. It can increase your risk of tardive dyskinesia, especially with the long-term use. It can raise your blood sugar or cholesterol, right? So just be aware of that. It can increase some harmful thoughts in young adults, so you definitely want to be reporting that if you notice it. It's not approved for any kind of dementia-related psychosis. Theoretically, it can be used, but there's other meds that are used more frequently in that case. And you just want to be cautious if you have a liver or kidney issue because it is metabolized by both of them. So nice things about it, though, you can take it once a day with or without food. You definitely want to be patient with this, especially if you're treating add-on depression. It can take a couple of weeks to notice the benefits. And you want to stick to your schedule too, but don't panic if you don't miss a dose, right? Because it stays in your system. And definitely let your doc know if you experience any kind of restlessness or physical agitation, because that's the most common and unique side effect with the Vraylar. So overall, once daily, so it's nice, used for schizophrenia and bipolar, but also the depressive phase as well. it can help balance dopamine and serotonin. So this can help regulate mood and thinking, and that's what gives it unique benefits for depression, right? That the most of the other antipsychotics don't have. It's got a long half-life, so that's helpful, right? Side effects are usually mild, and it can have less sedation or weight gain. So that makes it a good choice for a lot of patients. But you always want to follow your prescriber's instructions too, and like make adjustments accordingly. Okay, here's what we got to know about generalized anxiety disorder, GAD. So, this is more than just occasional worry or nervousness. So, this is more of a condition where anxiety becomes chronic, excessive, and difficult to control. So, it often affects your everyday life, even if there's no reason to feel anxious, right? Like, this is very much generalized, right? Generalized mean like all the time. So, it can be chronic, excessive, and difficult to control. So, it's not just like a casual one. People describe it like they feel on edge, they're overthinking, or they're constantly waiting for something to go wrong. So the common symptoms of this includes persistent worry and physical symptoms, and these last for 6 months or more. So be mindful of that. So the emotional symptoms, right? So it's constant worry that feels uncontrollable, overthinking, worst case scenarios, trouble relaxing or shutting off your brain, irritability or feeling easily overwhelmed, and trouble concentrating or feeling mentally foggy. So, all of these are the common symptoms of GAD. And then there's physical symptoms too, which are muscle tension, restlessness or feeling keyed up, fatigue, trouble sleeping, and an upset stomach, nausea, or headaches. So, what causes GAD? It's caused by a combination of genetics, brain chemistry, personality, and life experiences. So, genetics, definitely, right? Like, if you're more prone to anxiety, then that makes a difference. Also, if you witness more anxiety growing up, right? Like, let's say your mom or dad was definitely an anxious person, then you become prone to that too. So, that's where that personality characteristics really come in because they develop at an early age. So you might be more prone to perfectionism or a need for control, and those two things lead to significant anxiety. Brain chemistry issues too, right? If there's changes in serotonin, norepinephrine, and GABA, then that can be a consideration as well. And life experiences, right? How you deal with chronic stress, any kind of trauma you had, unpredictability growing up, like if there wasn't stability, that leads to a lot of anxiety. Um, but it's definitely not just in your head. It's a real thing. Like a lot of people, it really affects their life, and I see it very commonly. For example, stacked with ADHD a lot too, where it's like you might have trouble focusing and doing things and meeting deadlines and tasks, and that leads to anxiety. So how the GAD is treated. So nice thing is that it's very treatable, and most people do get better with the right plan. So a good treatment usually involves a combination of stuff. So cognitive behavioral therapy, CBT. So it's one of the most effective treatments for GAD. And the way it works is basically in CBT, there's three different pillars of it. So there's like your thoughts, your feelings, and your actions. And what happens is that you start realizing that they're all connected. So for example, let's say you have a thought like, oh, no one's gonna like me, so I'm not gonna go to this party, and because no one's gonna like me, right? Then you avoid. Then the feeling is that you feel down, you feel sad, you feel withdrawn, and then the action that you take is that you don't go to the party, and then that leads you to feeling, oh yeah, I definitely shouldn't have gone, or I'm worthless. I was too scared to even go, and then the cycle worsens. So the idea with CBT is that we try to reverse the cycle. So that's why you challenge unhelpful thought patterns, right? You learn new coping skills, you reduce avoidance and fear driven patterns, and you change that cycle of overthinking and worry. So therapy usually takes place weekly, right? And that's what leads to long term improvement. Uh, Medication. So medication can help reduce the symptoms, And so this is the key thing, right? By adjusting some of the neurotransmitters. And so this is the key thing by helping reduce some of those symptoms. It's super helpful, super important because think about it like imagine you're trying to do physical therapy, but your leg's always in pain. So it's a lot easier to do physical therapy if your leg doesn't hurt than if it's like stabbing pain, right? So it's the same concept. It decreases the intensity of a lot of the symptoms so that you're able to do the therapy. That's why they work in combination. So first line options are generally like SSRIs or SNRIs, right? They take a few weeks to work, but it's better for a long-term solution. Other options are buspirone or Buspar. So this is a non-sedating anti-anxiety medication. Usually it's used as an add-on to an SSRI or SNRI. Hydroxyzine, so it's an antihistamine. It's used for short-term anxiety. Benzos are used short-term, but they're not the best for long-term use, right? But I have some patients with severe issues who do use it. And beta blockers too, like propranolol. So it's used for the physical symptoms like a racing heart. I'll even add on performance anxiety, which is a common use of propranolol as well, like you're giving a speech or like a presentation. And so, there's no right answer for everyone. So that's why you work with your provider to find the right answer for you. And then there's also lifestyle strategies too. So daily exercise, right? Walking has been shown, or exercise releases endorphins, shown to help sleep hygiene, right? Making sure that you're sleeping consistently, you're getting a good night of sleep, right? Mindfulness and meditation. This is so underrated, but basically, when you become aware of the negative, anxious thoughts you have, you can change them, you can challenge them. Limiting, limiting caffeine and alcohol. That's a big one. And routines and journaling too. Like oftentimes thoughts can be very swirling in your mind, but then when you get them out onto paper, it's a lot less scary and you're able to challenge it a lot easier. So, hold on. All right. Throat's definitely dying here. And then the last thing is psychoeducation and support. So just like learning how anxiety. Oh my gosh. Oh my gosh. Yeah. Yeah, grounding techniques. That's another one too. I'll add that in. So another one that you can use is grounding techniques. And basically, the way that this works is, when you're stuck in your mind, your mind's kind of going haywire. It's doing a lot of thoughts in your head, right? So when you're grounded, you get connected to the present moment. And when you by connecting to the present moment, you realize that okay, nothing matters except like being here, being right now. So it's instead of being stuck in your head, you're focused on only just one thing, which is the current moment. And so that can be really helpful for um, anxiety as well. So, and then lastly, just education, just like learning how it works, helps you feel in control, understanding how CBT, cognitive behavioral therapy works. So, support groups, coaching, educational programs, they can help all like, normalize the experience, just like the program you're in now, right? You hear that, okay, other people are going through this, you're not the only one. And it can help reduce shame and confusion too. Like, it's definitely a thing. So, there's no shame that's needed. Uh, Overall, though, so it's a real condition, right? It becomes chronic, hard to control. It affects both your mind and body. Therapy, especially CBT, so that's one of the most effective treatments, so that's nice. Meds like SSRIs and SNRIs are often used for long-term control, and lifestyle strategies and education too can also play a role. So it's like everything kind of stacks together. So just remember that you're not alone, right? And with right support, right treatment, it can absolutely and get better and improve. Who is WDE? Did Almighty ever call it? No, I was never good enough to be a shining star of uh, Abu Bakr Almighty. Yeah, who are you, WDE? Did we were we in the same class? Okay, so now here's what we got to know about borderline personality disorder or BPD. So this is a more of a slightly more controversial diagnosis, but it's becoming more mainstream now. So it's called BPD or EUPD, emotional unstable personality disorder in the UK, but in the US we call it BPD. So it's a mental health condition. It's often marked by intense emotions, unstable relationships, and a sensitive reaction to rejection or abandonment. So people with BPD, way I describe it is that it's like the highs are really high, but the lows are really low too. They feel things way more strongly, and their emotional world can really shift quickly. So it's like they often lack that or struggle with that center, like that centeredness, that stability. So that's why it leads to ups and downs. It becomes very painful, right? Because it causes consequences in your relationships, maybe in your work and job, and just like how you feel. Um, but yeah, you can feel misunderstood or invalidated, but with the right support, it's definitely a treatable thing. So the common symptoms of it, so it's you want at least five of these. Well, I'm not saying you want, but like a diagnosis gets you five of them, or includes five. So fear of abandonment, extreme efforts to avoid it, right? So this can manifest in like relationships where you might do stuff to avoid getting broken up with, or you might break up with the person first to avoid feeling abandoned. If someone doesn't text you, you might feel abandoned. Uh, Someone like, let's say, flakes on a date or something, like things like that, right? All those, they can cause that fear of abandonment, or that abandonment can cause like that's one of the signs of it. And then you have efforts to avoid it too. So unstable, intense relationships that swing between idealizing and devaluing others. So this is a key. Like it's hot and cold. Sometimes they might be. You might feel like someone's your best friend, and then other times you feel like you hate them. It's called splitting. That's a thing. That's a term that we use in the medical field. But idealizing or devaluing others, aka splitting. Unclear or shifting sense of self, right? So that's important. Impulsive behaviors like spending sprees, unsafe sex, substance use, right? The impulse is very high too. This unclear or shifting sense of self, it's like you don't really have a self identity. So therefore, it's like you might latch onto other people's identities. You might take, like, let's say you're in a relationship, you take on the characteristics of the other person, what they like, what they don't like, their hobbies, or like let's say you take on characteristics of people in media, celebrities and stuff, because like you don't really have your own kind of core identity. uh, so repeated harmful thoughts or harmful behavior, right? This is a common one. This is what usually lands people in the hospital, is the this stuff right here. That's what gets attention. That's what gets people in the hospital. Chronic feelings of emptiness. You feel like there's a hole inside you. I've heard patients describe like I'm kind of like a donut, where there's a big hole inside, and that hole, that emptiness, comes from that unsensitive self, right? You don't know who you are, you don't know what you want, and you just take on characteristics of the world. Intense and rapidly changing emotions, right? Hot and cold, up and down, difficulty controlling anger or frequent angry outbursts, right? And paranoia or dissociation under stress. So this is very underrated symptom that can happen like low level for a lot of BPD patients. So, what causes BPD though? So it's a result from a mix of stuff. So genetics is very common. So family history of mental illness. So that can be it's a hereditary thing. Childhood trauma and neglect. This is a big one. For example, I remember when I was in my first year of residency, there was or when I was working the inpatient unit, the inpatient psych unit, pretty much every patient who had BPD, like they always had some kind of trauma. And I remember always realizing this and like, making that correlation. I was like, oh my God, like these things are so related. Like are, there's no way that they can't be. Brain differences, right? So there's irregular activity in emotion regulating regions. For example, people with BPD, they might have overactive amygdalas, which is their fear center, or maybe the underactive frontal lobe, which can also stack with ADHD, where you're not able to control emotions nearly as well. So that's two common regions, right? Emotionally invalidating environments during development. So if there's poor attachment that forms, basically there's an attachment study, right, where like there's a kid and then the mom leaves the kid, and you test out basically when the mom comes back, how does the kid react? And if basically the consensus is that if you had unstable attachment figures growing up, especially early in development, basically you couldn't trust your caregiver to be there and to nurture your needs, then that can lead to a lot of instability too later down the line. Like, it's been shown at a neurologic level to actually affect your brain chemistry and your brain cells. So it's definitely a thing. And then of course, it doesn't have to be just during the early years. It can be later on in adolescence, teen years, toddler years, etc. So don't think of it like a flaw. I know a lot of people do. It's definitely a treatable condition. It's well known, right? And so so let's go into the treatments. So psychotherapy, so that's the number one type of treatment for it. There's a thing called DBT, Dialectical Behavioral Therapy. It's the one that's got the most evidence behind it. And basically there's 4 skill areas that you work on. So mindfulness, basically staying grounded in the present, right? So rather than kind of letting your thoughts go haywire, you basically stay in the present moment. Distress tolerance, right? So basically being able to handle crises. So in BPD, it kind of feels like everything is a crisis, right? Like everything is so severe. So being able to withstand distress is super key, just like a high level person, like a high level CEO, or like, let's say, the president or whatever, right? They're able to withstand more stress than someone who maybe just like, works at McDonald's, right? Not as a comparison for jobs or anything, but just as a level of stress tolerance. And so that's what you're working on, is you're building your level of stress that you can tolerate. Emotion regulation, so being able to understand your emotions, be aware of your emotions. There's a thing that we do, especially if someone's hospitalized for DBT, and especially in the we did this a lot in the adolescent population. It's called a root cause analysis, or like a chain link, where basically you try to figure out how your reaction became so severe. So, for example, like, let's say you find out that you ended up self-harming, right? Well, it doesn't just happen. It might be like, oh, I saw my ex, and then that triggered me to think about my ex, and then I thought about all the memories that me and my ex had, and then I thought about, why am I so worthless? Why don't I have these memories? Why don't I have my ex anymore? And now no one's gonna want me, so therefore there's no point in me being alive. So you see how there's a chain there, right? So being able to identify that chain is super helpful in being able to regulate your emotions. And so that's how it all stacks, right? That's where the mindfulness comes in, because then you become more mindful of the events that led to it. The distress tolerance comes in, so because now you're able to withstand more stress than you were able to before. And then interpersonal effectiveness comes in too, because then you're able to use these skills to help you with your relationships. Because ultimately, the biggest thing that BPD people often struggle with is their relationships. The relationships are hot and cold. There's never stability in them. Setting boundaries, they can get taken advantage of, or take advantage of other people too. You can get manipulated, or you can find yourself being manipulative. So it's either or. And yeah, so being able to navigate your relationships, because ultimately that's one of the most satisfying parts of life, right? So you want to be able to get your life back and be able to navigate your relationships well. There's other therapies that are used too, so mentalization-based therapy. So this helps you understand your own thoughts and your others' thoughts, and their feelings more clearly, so that way you can respond rather than react. So, for example, with like internet trolls, right? Like, people always ask, like, how do you withstand, or how do you, when people talk negatively about you, they say shit about you, does it bother you? And I'm like, well, like, not really, because I understand. Okay, they're trolls. Like, their lives are probably worse than mine. And like, that's how I rationalize myself too. I feel myself getting worked up, but I don't need to just react to it. Schema therapy. So that's where you identify deep-rooted emotional patterns or schemas from childhood, and they help you change the beliefs and behaviors that keep you stuck, right? So oftentimes there's like deep-rooted stuff like, I'm worthless, no one wants me, parents don't love me, nobody will ever love me, I'm stupid, I didn't do well in school, so I'm dumb, I'm not intelligent, like stuff like that. Like, these pretty much, these patterns just get locked into childhood, locked from childhood, and so uncovering those and changing them can really help. Transference focused therapy. So this is helpful to explore how you view other people and yourself and helping you shift unhealthy relationship pattern. So this one's really focused in on towards your relationships with other people. And even just supportive or psychodynamic therapy with a strong therapeutic relationship. So this is supportive therapy is basically just like you get support. It's literally what the name says. But psychodynamic is when you delve more into like your thoughts and how they work and the unconscious motivation behind the thoughts. So these are less used for BPD. This is more like separate. This is more deeper type of work, but definitely DBT for sure. Uh, so there's no medication that treats BPD directly, but a lot are really helpful for specific symptoms. So this is where I would work in conjunction with a good therapist to help. So mood stabilizers we use, like Lamotrigine or valproate, they can help reduce the emotional volatility, ups and downs. Antidepressants, they can help occurring depression or anxiety, which is common. Low dose antipsychotics like Abilify or quetiapine. This is usually my favorite strategy, and this helps with the impulsivity or mood swings. Lamotrigine is good as well too, but it's used as a support. It's used as a support to help you get to what you need to do. So, crisis planning. So many people with BPD, so they benefit from having like good safety plans and support systems, and so that's important having a crisis or safety plan because then when you're in the moment, like I've had patients keep safety plans in their purses, so they'll look through it and then be like, okay, like it reminds them that okay, I don't need to react on it. Uh, Access to coaching, peer support, or crisis hotlines, right? So just that access, and then just good compassionate relationships that avoid judgment or abandonment. So a big thing with DPD or BPD is co-regulation, meaning that you bounce off of other people's emotions and stuff, right? Because they have the empty center of self. So when you have other people's emotions and things that react, then to bounce off of, especially if they're stable, then that helps ground you as well. So, and then just education, right? Like learning about it, that's what reduces the shame and increases your motivation. You know it's a thing and you know that other people struggle with it. It's not just you, right? So people often, like other providers will ask me that, should you give a diagnosis of BPD or not? And I used to think that, oh, it's stigmatizing, but every patient I've told that they have BPD, they actually get relief from it. Like they're like, oh, thank you for like identifying that. So I've changed my stance on it. I actually believe that it's good to tell people that this is what you believe they have, right? If you do, because it just validates them and it makes them, and now they can go research into it. They can see that other people deal with this. They can see that there's treatment for this, and it's not just a thing that's in their own head, or it's not just them. Like it's actually a well-known thing. Families learn to support without enabling or criticizing, and then you see emotions as signals, right? Not just overreactions. So overall, BPD involves emotional sensitivity, abandonment, difficulty managing relationships and identity. It's definitely treatable, especially through DBT and other therapies. Medication can help the symptoms, but it's not the main form of treatment. And recovery takes time, but people, they can build fulfilling, stable lives. So I remember when I was in residency, I often found that just like I tend to be more of a, I guess, stable, grounded individual. I found that a lot of individuals with BPD tend to actually seek me out for treatment because of this reason. And yeah, I remember at one time I was, it suggested that I open up a BPD clinic actually to take this more seriously. So it's definitely something that I think a lot of clinicians don't get credit for, and yeah, and I think there's a lot of stigma behind it too. So you want to make sure you're working with someone too who doesn't have that stigma and is patient and is able to work with you through this process. Yeah, BPD is borderline personality, not bipolar. Bipolar is just called bipolar. Okay, I heard someone say they've never seen skinwalkers in Appalachia. They've seen sac. I don't know what that means. I'm at 40 milligrams at now for Zach with my OCD. Okay, you're welcome. People like answers and diagnosis as to feel the way they do. Yeah, exactly. It's a relief rather than what's wrong with me. Precisely, precisely. Yeah. Does taking Invega while pregnant cause birth defects in the child? Some people need it. It doesn't, not all the time, but it can. Is he recording this for YouTube? No, I'm not recording this for YouTube. This is for my coaching Q&A program. So basically, I have a Q&A program where patients, people with mental health conditions, or people wanting to learn more can ask me questions directly about their mental health conditions, things that they're experiencing or their medications. And I answer, like I do a Q&A, otherwise I answer them in week format or in a video format. So basically, if you felt like no one ever answered your questions, you have so many questions about mental health or about your health that like no one ever answered, that don't make sense, Googling doesn't make sense, then you're the type of person who I think would really benefit from this. So it's in my bio. The site is called Psych Q&A program, or you can just send me a message too, and I can share more about it. So that's the one way to do it. Joy, thank you for the subscription. Yeah, so now I'm gonna do bipolar. I will sign up this summer. Nice. Yeah, so thing is though, if you wait, the price is gonna go up. Like we've had this for about, I started this 2 days ago, or maybe it's been 2 to 3 days ago. And literally we've had 18 people sign up. Let me check the recent number. 19 actually, yeah. So we've had 19 people sign up, and so I'm doing a bonus for the first like 25 founding members. But then after it gets bigger, it's going to get more expensive, right? So definitely, if you're considering it, now is the time to do it. Otherwise, it's gonna get more big. So your question is gonna probably get more hidden among everyone else answering. So that's why if you want me to be able to answer your questions a little bit more directly, and get a little bit more personal attention before the group blows up in price and people, now is the time to join. No, it's not really a time thing. You basically just join, and then you can ask your question. I'll answer it in a video response. So yeah, like literally I'm going to be compiling everything together and then like responding. And I'm literally making content right now. This is for the group, so all the stuff that people are going through, like I want to give detailed education on that. So you're saying there's help for those with BPD? Yeah, of course, of course. There's definitely help for people with BPD. Okay, now it's time to do bipolar. Okay, here's what we got to know about bipolar. So this is a mental health condition. So it causes shifts in mood, anxiety, and activity, and it's way beyond like the typical like ups and downs that you have. So it can cause episodes of mania or hypomania, which is an elevated or irritable mood, and depression, like a low mood, low energy, or motivation. It can affect your sleep, your thinking, your decision making, and the ability to function day by day too. So, but overall, with the right diagnosis, the education and treatment plan, like many people with bipolar, they have full stable lives. And basically, there's a various types of bipolar. So the main one is bipolar 1. So that involves a manic episode, which could have a depressive episode that follows it. And the mania typically lasts 7 days and requires a hospitalization. Then there's bipolar 2. So that's where you have a manic episode, hypomanic episode, which is less severe, and a depressive episode as well. but then they're often more times in depression. And then you have cyclothymic, which involves ongoing mood swings with milder hypomanic and depressive episodes that last 2 years, but they don't meet the full criteria for mania or major depression. So the best way to think about this is like, imagine there's three different tiers. So most people are euthymic and they're kind of, which is like neutral, and they're going here, here. And then they might have a depressive episode that lasts, and then they might go euthymic and then depressive episode. But then they also might have a manic episode, and then they go to euthymic. And so a common story is that people start off euthymic, right? And then they might have depressive episodes, they get treated for depression, but then they don't realize that there's a bipolar until there's a manic or a hypomanic episode. And then it's like, oh, that there's definitely like a bipolarity aspect to this. So symptoms include elevated or irritable mood, increased energy, talkativeness or activity, decreased need for sleep, racing thoughts or jumping between ideas, inflated self-esteem or grandiosity, impulsive or risky behavior, and distractibility. And so mania tends to be more intense, and hypomania is more milder and doesn't cause severe impairment. So for example, a patient case I had was, I had a 19, 20-year-old female, so she was an EMS driver. She was taking a bunch of caffeine, and she was bipolar, but she got off her meds. And so she told me this after the fact, but she was driving her vehicle with her partner, and the partner had asked her to pull over. So she pulls over, and the partner says, okay, let me drive. He takes over, he starts driving, and he drives her to the hospital. And so she's like, why did you drive me to the hospital? And he's like, because you were going at 120 on a 60 lane road. And so it turns out that she was having a manic episode. She was speeding through, like weaving in and out of traffic, and during a non-emergency situation. So yeah, it's definitely a thing. It can definitely cause consequences. I've had patients like spend $5,000 like on Amazon. I had one patient drive from one end of the state to the other end of the state. I've heard stories, like I had a patient who got in the car randomly with some stranger, and then they went to a hotel room, and then she got assaulted there. So there's definitely consequences that can come from bipolar manic episodes. And then there's the depressive episodes, which have similar symptoms to all the other symptoms of depression. So what causes bipolar? So genetics is a big one. So it tends to run in families. People who have it as a kid, or people whose parents have it, they tend to have it too. Brain chemistry is a big one. So imbalances in dopamine, serotonin, and other circuits, right? Some areas have been found to be very hyperactive in bipolar disorder. I forget which ones. Areas are most brain active in bipolar disorder. Will these notes be available? Yeah. So I'm going to be uploading all this stuff into the program, so you'll be able to see it. Yeah, there's life stressors. So, trauma, major life changes, or lack of sleep. So all of that can trigger an episode. So basically euthymia is like stable, right? Stability. But then if you kind of get off of that, that's where you can lead into the depressive or hypomanic or manic episodes, and then sleep disruption. So that's a big one. For example, I had another patient who was, she got triggered by ketogenic episodes. Or sorry, no, we treated her with the ketogenic diet, but she got triggered by alcohol. Like that was a big trigger for her. So yeah, it's a definite medical condition that people have, right? It's well studied, and so responds well to care. So the gold standard treatment is mood stabilizers. Usually that's the go-to. So it can prevent both manic and depressive episodes. So lithium, so this is the gold standard that we consider. It's got the best evidence. It's the strongest overall. Good for long-term mood stabilization. Really helpful for getting people out of the mania too. Valproate, Depakote. This is really helpful for getting people out of manic or mixed episodes. Mixed is basically a combination of mania plus depression. Or it's like a manic episode with severe hyper irritability. Lamictal or Lamotrigine, this is very helpful for bipolar depression. And then carbamazepine or Tegretol, this can also be used for treatment-resistant mania. It can be added on to existing mood stabilizers. And then atypical antipsychotics. So these are used for both mania, bipolar depression, or with maintenance. So Vraylar, Latuda, Abilify, Zyprexa, Seroquel, all of these are used because they have mood benefits along with bipolar benefits too, along with psychosis benefits too. So, my favorite is Seroquel because it helps people with sleeping, but all of these are used. I've used Zyprexa a lot too to help with mood stability. And then some are mainly for bipolar depression, like Latuda, Vraylar, and Seroquel. So they have extra benefit for bipolar depression, but they can be used for the manic side too. Antidepressants can also be used, especially for the low end of bipolar. It just requires some careful supervision because you don't want to trigger mania, so it's always paired with a mood stabilizer or an antipsychotic to reduce the risk of triggering it. For example, a common one is combining Zyprexa plus Prozac. That's a good combo for depression and mood stabilization. Therapy. So therapy helps people manage symptoms, prevent the relapse, and cope with stress and just become aware of stuff. So CBT, it helps people identify and challenge their negative thought patterns. There's also interpersonal and social rhythm therapy. This helps on stabilizing daily routines and sleep. There's family-focused therapy. So this involves loved ones in learning communication and crisis planning. CBT is the most helpful, I think, just because if you're aware of your thought patterns and you're aware of your own behaviors, you're more mindful, then you can catch episodes before they get too severe. So lifestyle changes are a big one. So regular sleep schedule, mood and energy levels over time, track them, avoiding substances that are triggers, recognizing early warning signs, sticking to a medication routine, ketogenic diet. So I've successfully treated patients with ketogenic diet before, just because it found to be helpful in seizures, and so that also makes it helpful for bipolar as well. But overall, so bipolar involves shifts between depression, mania, and hypomania. It's very treatable, so with meds, therapy, and lifestyle changes. So you just need to definitely recognize that it's a condition and then, seek out the appropriate treatment. Stability improves with time, with structure, education, and self-awareness. And just remember that you're not alone, right? With support, like people who have bipolar, they definitely have full and successful lives. This is true. Yes, this is facts. Can you do social anxiety? Yes. I'm going to do Lamictal right now, but I will do social anxiety. Yes. Yeah, so the best way to get all of these is to join our Q&A program. And so now or just send me a message. But now is definitely the time to join too, because we just started it. And so that's where it's going to be the cheapest, and that's where you're going to get the most direct access to me as well, directly answering whatever questions that you have, right? So that's the key here, answering the questions that you have, because it's so hard for me to do it over live when there's a whole bunch of different, there's a whole bunch of people asking here, right? We have 54 people here, and I can't really get a detailed look into what's going on. So that's, I think that would be really helpful. And there's nothing else like this. I've never seen anything else like this online, where you can actually ask questions from a psychiatrist and get actual answers without without signing up without asking your own psychiatrist or your own doctor who'd pay hundreds of dollars per visit for. Okay, so now we are going to do Lamictal or Lamotrigine. And social anxiety, that's actually a good one to do next. But I still need to prepare that one, so I can't really do it immediately. My husband was, what are you talking about? Where do you join? Yeah, so if you check my bio, that's the best place to see it. It should be called Ask a Psychiatrist a Question. It's too difficult for people to access mental health treatment. Exactly. So that's why I literally created this program. Is for people who have difficulty accessing mental health treatment. So definitely check that out. So that way, you're an informed consumer about your mental health and you actually know what's going on. Yeah. Also, I have not forgotten about your inositol request, by the way. I'm going to be making a video on that as well to explain it. Because I figured that would be better than like a DM. Yeah, all the details are in my bio. That's the best place to check it. Okay, so here's what we got to know about Lamictal or Lamotrigine. So this is a med that's used to treat mood disorders and seizures. But in psychiatry, like the way I would use it is for mood disorders. So we use it for bipolar disorder, especially for depressive episodes. But it's got a lot of use for other mood stabilization like depression, irritability, BPD. So those are some of the off-label stuff. The nice thing about Lamictal is that it's not sedating and it's less likely to cause weight gain. So that's more or cognitive like slowing too. So important to recognize that. But the unique thing about it is that it has to be taken consistently and it has to be titrated up slowly. So Lamictal is mainly used for bipolar disorder to prevent depressive episodes. Neurologists use it for seizure disorder and sometimes for like treatment-resistant depression as an adjunct or on its own. So, for example, I'll often collaborate with a neurologist. Like if there's a neurologist who, if the patient has seizures and they're also a patient in psychiatry treatment, then the neurologist often will use Lamictal or Depakote because they know that there's mood benefits there too. So it comes in a variety of forms: 25 milligram tablets, 100 milligram, 150, and 200. There's like chewable tablets as well, but I've never really seen this used. And there's oral dissolving tablets, and there's extended release as well too. But by and large, what's most insurance cover, what's the cheapest, and it works well is just the standard tablets. So the only thing is that there's a severe risk of rash. Like there's a skin condition called Stevens-Johnson syndrome, which I'll talk about. Basically, we have to start at a low dose and slowly titrate. So basically, we start 25 milligram once daily for 2 weeks. Then we go to weeks 3 and 4, go to 50 milligrams. Then week 5, go to 100 milligrams. Then week 6, go to 200. And generally, 100 to 200 is the go-to dose. The max dose is usually 200 for monotherapy, but sometimes you can go higher too if there's like other combination with meds, or it's more of a resistant case. Then I can go a little bit higher because of this. In neurology, they typically go to 400 for seizures, so like you can tolerate it. But some other medications can alter Lamictal levels, like Depakote or carbamazepine. So definitely worth, if you're on one of these, then like your dose is going to be a little bit more coordinated. So Lamictal basically, it affects sodium channels in the brain. It reduces the release of glutamate. So it's a neurotransmitter that's involved with mood and seizure activity. And so in bipolar disorder, it helps stabilize mood, especially by preventing depressive episodes rather than treating acute mania. So that's super important. So prevents bipolar depression episodes. It's less likely to cause weight gain, sedation, or sexual side effects. It's well tolerated with gradual titration, and it can help improve mood stability and cognitive clarity. So all these things are super, super important, right? Helps reduce glutamate release, which is excitatory. So that's what helps with mood stabilization. Common side effects are headache, nausea, upset stomach, dizziness, lightheadedness, insomnia, blurry vision or double vision, and mild rash in a small percentage of patients. I'll also add a common one I've been seeing a little bit more is memory memory fogginess. That's the best way to describe it. Basically, it's like a little bit of cloudiness. I've had a couple patients, like brain fog, basically. I've had a couple patients describe that. Uh, but the main big one to be aware of is called Steven-Johnson syndrome. So basically, it's like a severe, serious skin rash. It's very, very rare. But if it does happen, then you immediately stop the medication and you let your doc know, right? And it's most common in the first 2 to 8 weeks as you're building up. So that's why we titrate it slowly to reduce the risk as much as possible. Yeah, so if you notice a new rash, like not like a minor one, but especially if it's spreading or if there's any kind of fever or blisters, then you stop it immediately and you tell your doc. So you want to take it at the same time each day. Use a reminder or pill box, right? Because this is very key. If you miss steps in the titration, like say you skip it like more than 2 3 days, then we got to redo the whole thing over again. So you don't want to do that. Store it in a cool, dry place, right? You don't want the medication to deteriorate. And if let your doctor know if you start or stop any other mood stabilizers because it can affect your Lamictal levels. So overall, right, so it's used to prevent bipolar depression, but also to treat depression as well. Got to start low and increase slow, very weight neutral, well tolerated with mood stabilizer. Also, we use it to treat BPD. Also, I'd treat depression and BPD agitation, right? So side effects tend to be mild, so it tends to be one of the most tolerated. So that's really nice. And if it's taken consistently, it's really valuable for mood stability. So I like this med a lot. A lot of psychiatrists really like this med for good reason too. Yeah, Brooke. So the best place to see it is actually in my a Q&A program. So it's a Q&A program where patients can literally ask detailed questions about their mental health and get actual answers from a psychiatrist, right? It's hard to give good answers like this, on a video or just on live because so many people are asking questions and I can't really delve into like your specific situation in a little bit more detail, right? It's like it's so vague. But if you join the program, then you'll be able to get way more detailed answers there as well, and you'll have a community to be able to discuss things with. Because it's hard to get these kind of mental health answers online. And because a lot of people don't have good access to mental health care, so definitely be wary of that. So yeah, I think I'm gonna go call it here, go eat some lunch, but yeah, so definitely look at joining that, and now's the time you want to join because literally we've had 19 members join in the past 2 days, so it's been growing pretty quickly, and so the earlier you join, the cheaper it's going to be for one, and the more individual attention that you'll be able to get to your stuff. Because like once it blows up and it gets bigger, then it's going to be a lot harder for me to be a lot more individual. So look at that. The link is in my bio. And yeah, all these lectures I recorded today are literally for the program for questions that people asked on their specific topics, their specific medications. So you get full-blown lectures on this stuff and info, not just like a quick little answer on live. So otherwise, I hope that was helpful. And yeah, I'll probably be on a bit later tonight recording more lectures. So I will see you later.